it's a step forward. It's a patient-centered project. It always was. And in terms of looking at how we might introduce it further, we'd surveyed our staff afterwards, so from all disciplines, to see, number one, what was the experience of being in the workflow like? Was it more difficult? Was time demands higher than they would be with normal pathways? And also, did people feel that the quality of treatment was as good? Because I think we don't want to just prioritize convenience while sacrificing any kind of potential for inferior efficacy. So we were making sure that the quality was equal, and that's what was reflected in the staff survey. And so being convenient, I think, is the priority. Patients liked it. Treatment was effective. And in terms of who's going to likely benefit most, our target population was patients largely who lived a long way from the treatment centre. We've quite a few of those in Australia, given the size of the country. And I've spoken with some colleagues here from places like Canada, where they have patients flying to their department for their planning scan for one visit, and then they're going back home on a flight, and they're flying back down again 2 weeks later for their treatment. So it's really patients like that who stand to really benefit. It's only one trip to the metropolitan area instead of two. So large countries, you're going to definitely see a benefit for that for regional patients. But even in smaller geographical countries, it's still easier for a patient to only travel to a metropolitan area once. So I think they're the ones who really benefit. Then our other sort of second cohort who we looked at were the frailer patient who might find it difficult to commute. And we actually someone who had late kind of complications of previous pelvic radiotherapy, for whom coming to the hospital was really difficult as a result. So we were able to just ensure it was only one trip for that person. So I think mainly it's rural regional, but also the more comorbid patient who finds travel to and from the centre challenging. Yeah. So hopefully it'll be something that we can see a little bit more of as time goes on.